first video in the series, I wanted to talk about the pelvic floor physio. So I wanted to preface this with the fact that I personally have never been pregnant or had children, as that is often one of the only times that your physician or anyone else may recommend seeing a pelvic floor physio to you is after you've been pregnant. So it's typically a woman's thing because we have pelvic floors. So from the perspective of someone who has not, or even if you have, I wanted to ask you a few questions to see if maybe this is something for you to look into. So something that it's very helpful for is if you have a lot of that low abdomen or pelvic pain, for sure. Or maybe you also have a lot of pain and tightness during your periods, or a lot of like cramping and uncomfortableness. If you have a lot of unexplained like low back pain or pain in, you know, your hip region, your high hamstring, your glutes, that you've maybe been seeking a lot of other treatment and nothing quite is getting that spot for you. Also, if you have any issues with your bladder or your bowel movements, either you can't hold either or you have a lot of pain around those as well. And then also if you have a lot of pain and discomfort with sex or using feminine products or anything like that, maybe a lot of like tightness in certain areas. So if you think that any of those may be something that you're dealing with as well, like I was, I invite you to watch our second video, which is a little bit longer and details my experience with the pelvic floor physio, what it did, why I did it. Again, this was just something that I see a Pilates instructor for physiotherapy rehab, and we were talking about some of my symptoms, and she was just saying that a lot of the things that I had going on were very similar to issues that she had post having 2 children. So again, she's had children, I have not. However, stress and trauma in your body can cause a lot of those same kind of symptoms and issues, right? So you don't have to have had children. You don't have to be, I'm 34, you don't have to be my age, you could be younger, you could be older. All of our bodies are different. It's part of the fun of the human experience. So if any of these resonate with you, or if you find that you watch this video, or maybe someone else has mentioned it and now you're seeing this video and you're seeing this come up a couple times, which is what happened for me, again, I highly recommend checking out our next video. I will give you an in-depth review of what it was like, what happened, and how it's benefited me since. So I hope to see you there, and stay tuned for what's coming up next. Have a lovely day. Bye.